Well, this is a joint partnership between the Gibraltar Fire and Rescue Services, Royal Gibraltar Police and Gibsams. Our role here is to coordinate any calls that come in our direction to facilitate those people in need into the right direction and providing those services that are provided by the public services, here in this case medical, with those services.
I would imagine the liaison between the different services is crucial.
The key word is liaison, you're very right, but I think another very key issue here or priority is saving lives. We've had a number of suicides here in Gibraltar, and the ultimate aim for the Royal Gibraltar Police is protecting our people and saving lives. So working in partnership with the voluntary sector, particularly Gibsams, this is another avenue to be able to provide people with that service.
The RGPs, of course, you've got officers on the street, you deal with a lot of people who could have problems. So do you feel that you're in a good position to actually spot the signs?
Our officers are trained. We've received training from Gibsams and from the professionals of the medical sector here in Gibraltar. So in that regard, we are trained. But the Royal Gibraltar Police is involved in a lot of care for individuals that are suffering from mental health issues. On an average, an officer, if dealing with an individual, might spend good 4 to 6 hours going through the whole process of ensuring that that individual is provided that medical help. So the Royal Gibraltar Police is helping vulnerable people. We're in a key position to do so, and we owe it to the public of Gibraltar.
Basically, it's reinforcing the good working relationship that we already have with police. It's essential for Gibsams to be working with the essential services because they're the one who are facing people every day. They're in the street, they're dealing with people every day. So there's different facets of working with them. And firstly, as I said, with people in the street, every policeman on the beat now carries our card. If they see somebody who is distressed, they can give them the card and tell them to ring us, because they're not going to arrest somebody who's distressed, but they can offer help. We've done awareness presentations with them, so they all know exactly what we do, which means that they can talk to people, they can help us in that way.
Couldn't that be a double-edged sword in that people might not want to approach Gibsams because they don't want to get the police involved?
No, that doesn't come into the picture at all. This MOU actually safeguards the anonymity, because if we do need the police, they will respond to us straight away without us having to give any details away. So actually, as I said, the MOU actually reinforces the anonymity of the service, whilst at the same time we can guarantee a fast response when we need it, and we can have their help out in the street. I mean, there was a post on Facebook last week from somebody, I don't know who it was, who said her son was sitting in the car, head down looking at his mobile, and for any passerby he would look like a lowly young man, and 2 policemen came to check he was all right. That's the sort of thing that we need. By working together, by them understanding what we do, and we can count on them to help, that we can actually help the public.